Is there any common mistake as a gynecologist that most women do, and maybe if you can tell them they can avoid this mistake and live a healthy life? Generally. Hi guys, thank you so much for watching us today. A quick message. You might be watching this but have not yet hit the subscribe button below. It will mean so much to me, to all of us, if you subscribe. The more the people watch us, the greater the guests that we'll have on this channel to inspire us with their stories and experiences. Thank you so much, and now let's dive in. Kindly tell us what fibroids are.
There are benign tumors of the uterus that are hormone related and usually grow as long as a lady has a period.
Do you mean that every lady has fibroids?
No. Ladies around 40 years old usually start to have fibroids. We can find at any age, but usually around 40s. Around 40s, around 1 in 3 ladies has small ones. Ladies from Africa have more fibroids. They are hereditary usually. If a mother has one, most probably the daughter has.
What are some of the common symptoms that a lady with fibroids might have?
It depends on the position of the fibroids. If the fibroids affect the endometrium or are closer to the endometrium, they can cause heavy bleeding or abnormal bleeding. If they are outside of the uterus, maybe they are no symptoms at all, or if they are very big, they can cause pain and infertility.
Why do they cause infertility?
Because they get the blood from the uterus, so they can grow, or if they are inside the cavity of the endometrium, they do not allow the baby to grow inside the cavity.
Would you recommend women to have a screening to detect these fibroids?
It's easy to check with ultrasound. So if you make an annual checkup and you make also an ultrasound with your checkup, you can see them.
When is it recommended to have the fibroids removed surgically?
Usually the recommendation is if they are above 4 centimeters, is to have operation, and it depends also on the size and the position. So the size is above 4 centimeters, and if they are inside the cavity, we remove because they cause bleeding and infertility.
Okay.
So these fibroids are removed at any size.
Is there any other way to manage them other than surgical?
There is Mirena coil that keeps them stable and even shrinks fibroids. And menopause, it's the nature. Menopause shrinks fibroids. So if a lady has fibroids and gets into menopause, the fibroids will shrink.
Any special diet that a lady can take so that maybe to help reduce them in size, or?
There is a supplement for fibroids, it's called Delphis. It has vitamin E and D and other vitamins. This is considered to help the fibroids to stay stable or shrink. So yes, the diet most probably has its role in everything it has. This supplement is innocent, so all ladies could use it. Anyway.
Is there any common mistake as a gynecologist that most women do, and maybe if you can tell them they can avoid this mistake and live a healthy life?
Gynecologically, ladies should have good hygiene, and they should have an annual checkup in order to prevent problems.
From what age?
Usually ladies that have started to have sexual contact, and generally if they have not started, after the 20s it's good to have a checkup.
How do you remain happy in these difficult days?
I think that I get all my strength from my family. My children, my husband, my twin sister and my parents. This is my strength.
Thank you so much for your support so far. We don't take it for granted. We appreciate you. Click the subscribe button below and let us grow together. Thank you. Ciao.